The Victorian government has hit back at pre-election pledges from the Liberals to build a new children's hospital in Melbourne's west. The early campaigning is being fought on familiar ground, with Daniel Andrews and Matthew Guy hitting the hustings in identical locations.
The babies are already stealing the Spring Street show. As Matthew Guy and Daniel Andrews went to the Royal Children's Hospital for separate media events, the Liberals promising $900 million for a new paediatric facility in Melbourne's booming western suburbs.
And we believe the amount is right. So it will take some years to get that preparatory work done before we commence, but it will start in our first term.
The announcement aimed at securing swings away from Labor in Treasurer Tim Pallas's seat. But while their target is clear, the details of their policy are not. The opposition leader won't yet reveal how he'd staff the site, allowing Labor to take aim.
A hospital without staff is just an empty shell. That's what we can see from Matthew Guy and the Liberals.
Despite concerns services aren't keeping pace with population growth, the Premier claims Melbourne's west is already well serviced.
We've got a brand new women's and children's hospital out at Sunshine, which we built. It's open, it's treating thousands of patients right now.
As Daniel Andrews reiterated pledges for new paediatric GP clinics, one to be based near Melbourne's Royal Children's Hospital.
It is getting harder and harder to find a free-of-charge GP who has a spot for you, has an appointment for you.
The Premier argues that the Victorian state governments had to create these paediatric GP clinics because fewer practices are bulk billing. He says it's an issue the federal government must address.
The state government should not be providing any GP care. That's exclusively the responsibility of the Commonwealth Government.
But the opposition argues it's come far too late, with 6 days of winter to go.
This is another re-announcement by the government. They're desperate to sort of have something that is relevant. There should have been a campaign about COVID and flu and these respiratory centres set up. There wasn't.
As it seems, spring will all be about electioneering. Simon Love, Sky News, Melbourne.